The SPARK trial I've got divided into a few slides in accordance with what Lindsay George showed at the ISTH this past July. And it's a complex series of results. But hopefully I can describe it simply enough for us to get the take-home messages. They had 3 dose groups escalating. A total of 14 participants were treated. And in the first 2 dose cohorts, which is these 5 patients in the upper left slide, what we see is essentially a lack of a dose response in a range from around 4% up to maybe 22%. But we also see over a period of more than 2 years, and in one case going into 3 years, some durability. These appear to be stable factor VIII levels at these low doses. And so that's an important conclusion to make. As we then move into their next cohort, which is their highest dose cohort, they had 9 patients in this cohort. And here they see highly variable factor VIII responses. This shows 2 of the 9 patients in the graph in the lower right-hand corner. And in these 2 patients, shown by this dark blue line and this dashed blue line, there appears to be relatively stable factor VIII activity with no steroids required, no increase in transaminases detected, which are shown in the bottom 2 curves, bottom 2 lines here. And so this is going out close to 2 years at this point. And we see stability in these 2 particular patients in the high dose group. However, another 5 patients in the high dose group required reactive steroid treatment for elevated transaminases or loss of factor VIII activity. And so what we see here in the upper graphs in 3 of these patients is prednisone course and a tapering of that prednisone course. We also see in the blue lines then the factor VIII levels, and we can see that the factor VIII level began coming down with some mild elevations in the transaminases, but we've seen in other studies, including the factor IX studies, that that's all it takes, small elevations in transaminases to see loss of transgene expression. We also see this factor VIII level continuing to come down over the course of the next 2 years as well. In this patient, we had a nice, well, I shouldn't say nice, we had a spike in transaminase elevations in this case, and then the factor VIII level came down quite sharply, and really, despite the absence of additional transaminase spikes, we're left with a relatively low level of the factor VIII activity. And I believe these are all one-stage assays. And then in this last participant, no increase in transaminases, but a loss of factor VIII that prompted steroid treatment. In addition to these 3 patients, 2 additional patients in this cohort lost all of their factor VIII expression despite steroid treatment and needed to return back to their previous therapies. And then the final 2 patients in this 9-patient high-dose group are shown on this slide. These 2 patients received prophylactic steroids initiated around 4 weeks after vector infusion. And what we can see here are perhaps some small bumps in transaminase elevations in this patient, shown by the black line, and a large decrease from a supraphysiological level of factor VIII that may or may not be due to the steroid treatment to very low levels of factor VIII in this patient, despite no further elevations in transaminases. And then this patient also had a supraphysiological level, as you can see in this blue line here, began coming down precipitously. Patient was restarted on prednisone. Azathioprine was added, as this red bar shows, and the ALTs finally quieted down, but the patient did lose a significant amount of his factor VIII activity. So what we can see in this high dose group is a variety of different outcomes from from the therapy, and perhaps that's the reason why the group has decided to go back and do additional phase 2 studies to really try to understand the relationship between the steroids, the transaminases, and the factor VIII activity.